Hi, it's Timika Chambers, lifestyle coach / tutor for NCLEX candidates, integrated nutrition health coach. I have over 20 years of healthcare experience in a variety and various settings. I earned my MSN from the University of Missouri St. Louis and a BSN from Southern Illinois University at Edwardsville. And recently I heard I actually saw a comment about dealing with priority questions and how they can be a little bit of challenge. So as you know, priority questions fall under management of care. You're giving a select number of clients, and then they often ask you, who are you going to see first? What are you going to do first? What are you going to do next? And so those are kind of your priority types. And often I do find that many students know this, clients know this, they use the Maslow hierarchy of care. And so, as you know, taking care of basic needs first, that self-esteem often falls a little bit lower as far as caring for those type of clients. And then here we go, airway, breathing, circulation, safety is another option. Safety, discomfort, education, and feelings. So I usually will tell people, definitely look at airway. That's one of the major concerns. So we're looking at airway. Do they have a blockage of some sort? Are they having problems breathing? Then you can look at some heart issues. Do they have a blockage of something, or arrhythmia? Are they bleeding? Safety, are they safe? Discomfort, are they having pain? Do you need to do some education? They're stable, they're going to be kind of last on your list, as well as your feelings client. So I always say that, yes, it's important to have principles, but you also want to make sure you're reading every question and taking every question for what it is. And that's how I teach my clients to maximize each question. Remember, it's about how many you get right instead of finishing the race at 150. All right. So after a change of shift, you are assigned to care for the following patients. Which patients should you see first? Remember, I usually recommend read the question for what it is, because I often find that people, when they go to paraphrase, they're saying something a little bit different. And if you're on a different path, you're going to choose a different answer. Paraphrase. So I'm at change of shift, and I say use I'm because that's putting you responsible, and you're going to think like a nurse. And I have these following clients. Who am I going to see first? First is definitely going to be my key word, because I want to carry that with me as I go through these selections. Remember, you're not reading the question like this. After a change of shift, you are assigned to care for the following patients. Which patient should I assess first? And then is a 60-year-old. You want to take time to process the question before you go on to the question. Now we can do it. So do I see a 60-year-old? I see a 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to the lab. Or a 55-year-old with COPD and a pulse oximetry reading from the previous shift of 90% sat. Or a 70-year-old with pneumonia who needs to be started on intravenous antibiotics. Or a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. So again, you want to read the statements for what they are. You start breaking down. I used to start from top to bottom, you guys. So you have a 60-year-old on a ventilator for whom a sterile sputum specimen must be sent to the lab. This is more routine. They're not saying anything about the patient is having trouble breathing, right? Or signs and symptoms of infection. So they're not going to be priority on your list. A 55-year-old with COPD and a pulse oximetry reading from the previous shift of 90%. Well, look, 90% is actually within range. So you want to know what is the range for a COPD, someone who has COPD. 89 to 92% is normal, because remember, a low SAT stimulates breathing. 70-year-old with pneumonia, started on IV antibiotics. More routine, but I have the 50-year-old with asthma who complains of shortness of breath after using bronchodilator. He did not get relief after using a bronchodilator, therefore he did not receive the therapeutic effect. So he's going to be my urgent client. He has the airway issue. When you go on to your rationales, remember, try to pick those that give you a rationale. What is the correct answer and why, and what is the incorrect answer and why. And as you can see, he is the urgent one because he is not receiving the therapeutic effect, and he can have other complications. I got this question from Nurse Labs. So remember, if you want more support with questions, I do offer sessions. You can find that information on TamikaSChambers.com, and my notes that I've used for over the past couple of years in tutoring clients, refining them, seeing what students need, what are their most concerns. You can find those on Etsy, and I am having a 25% off sale too as well on those. So I wish you much success. Remember, you know more than you think you know, and you can do this. If one person can do it, you can too. I'll talk to you guys soon.